Good morning, everyone. So I'd like to welcome you all here. I'd just like to, before we start, say that this is a webcast meeting and it's being webcast live. So I'll just hand over to Helen for the apologies. Thank you.
Thank you, Chair. So we have apologies this morning from Councillor Orlandi Fantini, Councillor Doherty and Councillor Luca.
Okay, and now we'll move on to any declarations of interests. Anyone at all? No, that's great. So then we'll go to the minutes of the meeting held on the 21st of March 2025. Can we confirm that these are accurate? Fantastic. Okay, so next we'll go to agenda item 4, the Deprivation of Liberty Safeguards, an overview and update, and I'll hand over to the Cabinet for Health and Care for his report. Thank you.
Good morning, everybody, and I'm going to hand over to Ruth Martin on this part, who's got a finger on the button in all this area. Thank you very much.
Good morning, everyone. This may be the first time for a lot of you of meeting me, but not for all of you. My name's Ruth Martin. I'm the Principal Social Worker and Safeguarding Lead here at the County Council for adults. And I'm going to hopefully present this first report to you regarding the deprivation of liberty safeguards and our responsibility. Now, I thought it might be helpful, first of all, if I just gave a brief overview over what the deprivation of liberty safeguards is, just in case any of you aren't as familiar with it. I don't expect people to be, as I am. It is my job, so that's what I'm here for. So the deprivation of liberty safeguards was an amendment to the Mental Capacity Act and came into force, and it gives us a statutory responsibility to ensure that those people who are confined within a care home or hospital where they lack capacity, that they have the appropriate safeguards around them. That means that they have the right to a review and that they are there in their best interest. So that's the sort of general purpose behind it. The process itself is quite a lengthy process. It involves 6 separate assessments being completed by at least 2 different professionals, one of which has to have a mental health qualification, and the other one has to be a qualified best interest assessor. That's usually the social worker. So you often hear about the best interest assessment, but actually it encompasses 6 assessments overall, and it is prescribed by law. So those elements all have to be completed. Oh, that didn't sound too good. We have to complete that as well, or the law states that we should complete that within 21 days. I'm sure that you will all be aware that all local authorities have found this particularly challenging following the Supreme Court ruling, the Cheshire West judgment that came in that broadened the use of the Dole's criteria. This led to us ourselves as a local authority having quite a considerable backlog of nearly sort of 2,500. We have now reduced that quite significantly, and we now sit below 1,000, and we are now within 35 days of the assessment. So we have done a lot of work already around this, but there's still work to be done. A year ago, we were approved to use money out of reserves to look at the backlog and to ensure that we were more in timescales. But what we need to do now is look at how we can use our resources more effectively and reduce the spend that we currently have on doles, whilst trying to maintain our current performance as well. So a bit of a challenge, but we like to rise to that. So just for awareness, we receive around 800 applications for doles each month. So it's a very busy service. The number of these referrals has been going up steadily at about 19% every year. So you can understand that becomes challenging the further we go on. So we aim, as I've said, to keep the total number of DOLS applications below 1,000 and the number of applications that have been pending for more than 21 days below 400. So this then takes into account those timescales that we should be adhering to and that we must be, and then gives us reason to. You'd have seen in our recent CQC inspection that actually they have noted our improvement in those areas. So we have already been making some improvements, including shortening the assessment forms to make them quicker to complete, but without losing the detail that we need and ensuring that they are person-centred and strength-based in their approach. We have also, as I've said, been able to commission additional capacity to complete the assessments, and we have also taken steps to work with our hospitals to identify and close down applications from people within a hospital where the person has been discharged or moved. So we do have some further improvements that are currently under consideration, and this will be included in our next iteration of our DOLS improvement plan, which we are pulling together. We'll have a full-time line by October of this year. So these things will include the training of additional staff to be able to complete DOLS assessments. That's our in-house staff, so that we can reduce the use of our commissioned service, which is, as I'm sure you can appreciate, potentially more costly than using our resources internally. We are also looking at a further review of our assessment forms and some of the other forms that we currently use to ensure that these can be completed in the most time-effective way possible whilst remaining legally compliant. And further to that as well, we are also looking at utilising the ability to use more equivalent assessments, which is a process that we can use within the law. That means working with our providers and with our assessors to make sure that people are using equivalent assessments, like an equivalent mental capacity assessment, so that we can ensure that they are, that we as well are not overly assessing people, because this is the risk with deprivation of liberty. So that's where we're up to at the moment. I know it's quite a brief run through, but please do now feel free to ask me any questions to help your understanding. Thank you.
Thank you. So we'll go across to Councillor Edgeler for the first question.
Thank you very much. Thank you, Joe, for that. It's really interesting. I mean, I'm just interested in what sort of complaints you get. You know, what type of things people complaining about. If you could give us an idea of that. Thank you.
So with the deprivation of liberty safeguards, from the point of view of complaints, we don't really get many complaints from that perspective. But the situations for people are often where they are where they have dementia and are having to reside in a care home, increased level of need. People may have already moved into a care home and then over the course of their time there have begun to lose capacity, so can't consent to the care arrangements that are in place for them. So what we need to make sure is that any restrictions that are around them, that includes just basically living in a home with a locked door that they then can't exit, that is within their best interests, that they've got access to the right types of services and support, access to family and activities to reduce the impact of that deprivation as well.
Next question, Councillor Wallens, please. Thank you.
Thank you, Chair, and good morning, everyone. In relation to the total applications you got currently, I know you want to keep it below 1,000 and after 21 days below 400. What are the latest figures, if you don't mind me answering, or asking, sorry?
I certainly don't mind you asking that. So at the moment we are at 840 when I looked at the start of this week of total number of referrals waiting. And we were slightly above our target of 400 at 434 over 21 days at the end of last week. As I say, that number does fluctuate, so hopefully we will be back down, but that is something that's monitored through all of our sort of performance, so monthly performance meetings, and also through to SLT, because it's one that we report on.
Yeah, just a supplementary question to go alongside it. How does our performance compare to neighbouring authorities? Are they in line, or are we exceeding, or etc.?
So we are doing very well in comparison to our comparators, and I'll go for our comparators. So our local authority sort of comparator group, the SITFA group, you might have heard of it, has been described as. We actually sit within the top 3 for how well we do. So from the point of view of number of referrals as well, we are second. So we have the highest number, but we have some of the lowest numbers remaining in the country. Now, the latest figures are still to be produced, so I am going on some of last year's, but our initial indication is that we'll still remain within that higher performance group.
So then a question from Councillor Wilson, please.
Thank you. Good morning. If we're doing so well, why are we looking at shortening the application? I worry that we're throwing the baby out with the bathwater. I'd like to actually see the application form itself as it is now, and look at what you're proposing to do in the future to make... I completely understand that you're trying to streamline things, and that's great. But how does that affect the people that we're talking about that live in this county? The other question I had, just because I'm not all that au fait with this subject matter really, is who is it that actually makes the referrals? Are they always professional staff? It's not family members? Can you just give me a bit of a thanks?
No, thank you for that, and I think 2 really important questions there. If I answer your second one first, and that is that it's prescribed by law who can make the referral in, and it has to be the managing authority. The managing authority is the care home or hospital where the person is currently residing or is intending on residing, so that the referrals in are always made by them. That's the only people who can. Now, a member of family could raise it with us as the supervisory body, as the local authority, if they feel their family member should have a DOLS in place and hasn't, and we would then contact the managing authority to ascertain whether they've considered that process. Does that answer your second question? Yeah. Okay, shall I answer your first question first? Oh, I love it when it goes like that. Okay, so in answer to your first question, the forms are designed by ADAS. So we have forms that are used by ADAS. So we don't do this alone. We do this as part of the ADAS work group. So we're not making a decision independently as a local authority to shorten the forms. The forms, being a BIA myself, I could tell you were very repetitive. So I'd be repeating information throughout the length of the form, and I'm quite happy to share the 2 forms. We've already done some work around them. So we've shortened already the Form 3, which is the best interest assessment form. And actually, by doing that, we've made it more person-centred. Because for me, sometimes, if you're asking particular questions, it may not be relevant to the individual. So it's about making the form relevant. And actually what we do as well is we complete monthly audits across our BIA forms to make sure as well that they are in line with expected practice standards. And we also gather feedback from families who have, from the person's representatives, so from family members of people who have been through that process, to gather their feedback on how they feel the assessment went and whether the assessment, once they've received it, has been relevant to their needs. So we're trying to ensure that actually we don't lose the quality. Because it's prescribed by law, there's certain elements that we have to cover, and those are the elements that we will obviously continue to cover. But by all means, we can share the two, and you may see that actually we've basically created one box out of 6. So that then you have a free text box rather than having to answer. You had to answer, like I say, the same question it felt in multiple ways. Being an assessor, sometimes you just felt like you were saying the same thing a lot.
Just like to hand over for another question from Reverend Metcalf, please.
Thank you, Chair. Good morning, everyone, and thank you for the update. I'm picking up your reference to the numbers of applications increasing by 19% per year. Could I ask first, what are the factors that are driving this increase? Is it largely connected with an ageing population? And secondly, what are the plans looking ahead into the future? 19% means effectively doubling the number of applications in 5 years. Are you making plans for that?
So thank you for that question. So the 19% has been quite consistent over the last 3 years. We have done some projections going forward because I'm going to say this hopefully in a reasonable way. There's a point where you're hitting almost the top amount you can, because there's only so many spaces that we have in care homes, so many spaces that we have in hospitals, etc., and only so many people that we're going to have come through the assessment. Over the next 3 years, we expect it to, based on our projection, to increase by 29% over the next 3 years. So that's where we're currently doing our numbers from, to sort of try and get this plan that we're pulling together for October to look at how we're going to mitigate some of that increase. Because you're absolutely right. What we're concerned about is if we make reductions now in the amount that we do, that could actually be compounded by an increasing amount. So I could, on today's number, say decrease by 5% and be able to maintain my performance, but in 2 years' time, I will be, because of the increase, my performance will be in a very difficult position. And also for me, more importantly than the performance figures being that, it's people being potentially left at risk without an assessment being completed. So I always try to say, whilst when I talk about performance, I'm actually acutely aware that these are people and their lives. And actually, we have a statutory duty at the moment to be able to complete this. So the numbers do increase actually because of the ageing population. In the main, it also is to do with increasing complexity of need, increasing rates of dementia, and other things within our ageing population that then have led to this increase. I would also say the more you do, the more people become aware of it. So I don't want to say victim of our own success in that way, but because actually we do respond, we're doing what we need to do. Homes, hospitals, put that in, they get good response from us. We've got good relationships with our homes. They're doing the right thing, we're doing the right thing. So this is all good, but actually it's the pressure, obviously, it creates on our services and as well, on our teams as well, to be able to meet that demand.
Councillor Wilson, please.
Thank you. I'm finding this really interesting, and thanks for explaining it so clearly. And it's not a subject you should find interesting, really, is it? But, and just going back to what you were saying earlier, bureaucracy is our enemy, isn't it? But having to answer a question, 6 different ways, that's not at all a good use of time management. So just out of interest, is there ever a doles lifted? Do you get applications for people that no longer need it? And how does that process work?
Thank you for that. It happens rarely from the point of view of it needing lifting, because quite often it's people, as I've said, who have dementia, which is a progressive disease. But actually we do have people who, say, sustained a head injury, who then regain capacity over time. So as they start to recover, they regain capacity. So there's a review process, and this is why it's really important. This was the whole purpose of it, was for people who no longer needed that level of restriction around them or to be deprived of their liberty, that they had representation, which they have a representative who gets appointed to them at the point that the DOLS is issued, and they can request a review at any point should the person's circumstances change. So that can include either because there's been an increase in restrictions or hopefully because they've regained capacity. It also has to be reviewed every year, so this isn't a process we just do once. Every year that application needs to come back in. So just to give you some context around that, 40% of all of our 800 are renewals of a DOLS, and they have to do the same process as it stands at the moment. Hence why we're looking at being able to bring in the use of equivalents when we're doing those renewals.
I'd just like to hand over to the Cabinet Member, please.
Just to touch base with what you're saying, which is a really good question, is that in occasions as well, when these when these DOLs are put in place, they can have restrictions to them, so they can be reviewed in less time. So if there is a chance that we believe, when you're actually completing all the assessments to do with it, that that person's capacity might change within 12 months, you can put an attachment to it where they say this needs to be reviewed 6 months. So you'll only get a 6 months DOLS.
Councillor Wallens, please.
Thank you, Chair. I know I've got quite a few questions here. To be honest, I did do my homework last night, I must admit. When Councillor Wilson was on about shortening assessment forms, how do we assure that when we do shorten the assessment forms, it remains legally compliant whilst protecting individuals?
Thank you for that, and those are really important considerations. So as I've said, we don't do this alone. We do this alongside our ADAS colleagues. We work as a group of local authorities overseen through ADAS. And the statutory guidance makes it really clear over what you must consider during the assessment. And so we'll just make sure that we ensure that all of those aspects are considered. As I've said, each one has to be approved by us as a local authority, so a BIA will have completed that, and then somebody within the local authority as a supervisory, as a representative of the supervisory body, signs that off, and they'll be checking to make sure all of those aspects have been covered before it gets signed off. So if they haven't been, it goes back to the BIA for further consideration. As I've said as well, we do monthly audits to make sure that actually what we're doing well, and that includes both our internal BIAs, but also more importantly as well our external BIAs that we have through through our commissioned service. So they all get reviewed. We also seek the feedback as well, which I'm not saying that members of the public would necessarily know the legal obligations that we have, but to make sure actually that's been done in the right spirit and in the right way.
To the Cabinet Member, please.
Oh, thank you. Sorry. Thank you, Chair.
Sorry, Councillor Wallens said to the Cabinet Member.
Sorry.
Thank you.
Sorry, it's my turn. Just to touch base as well on your actual questions, every decision that's made in that DOLS is actually taken to the person that the DOLS is pertaining to. And every avenue that possible is used to see if they understand what the DOLS is about. From using Makaton, if they've got communication issues through stroke, to see how much input they can put into it. So the actual, the legal side is quite stringent, and as it breaks down, everything is based around that person, which gives you the holistic side of it. Again, that can change, but that person will be given every opportunity and every avenue to communicate their wishes. Thank you.
Councillor Nixon, please.
Thank you, Chair. Good morning, all. You mentioned training regarding additional staff. Presumably that's for efficiency and to improve the overall process. What I would like to understand is how long is that training, how in depth is that training, and when do you expect to gain the results from that investment?
Thank you ever so much for that question, really pertinent question. And I think the BIA training is a university accredited course, so it is done through our local universities. So we're looking at the moment at gathering the information from them with regards to cost, nature of the course, how well it's accredited, etc. So we look for the most sort of cost-effective in that way option for doing that training. Now, the training, as I hope you can appreciate, does take some time. I would be saying that we are seeking to start training within the new in the new year, because obviously we haven't had approval for that yet, and that will come out when we've done our report and presented that to Richard Harling to make sure that he's happy with that, and through any other governance process that occurs from then. So once we've got that approval, we would hope, because the courses tend to start 2 cohorts a year, so we would hope that we would get in that first cohort, say, within April. It's a 6-month course overall. They do a period of study, then they have to do a shadowing experience, then they have to do a supported assessment, etc. And then they have support for the following year. So in answer to your question, it isn't an immediate, sort of save. That is a long-term plan to look at how we improve that resource, to how we can improve our internal resources. So I would be saying that that's 18 months, 2 years before we'd have a fully fully fledged and effective new cohort of BIAs. We already have BIAs within the organisation, but recognising now the need to recruit more. What I haven't said, actually, which might just help us to go, why haven't you thought of this before, Ruth? Why are we only now just doing this? Is because there had been a period of time where there was supposed to be some new legislation coming in to replace DOLS called LPS. But the last government decided to postpone that going in, so central government obviously decided to postpone that, and at the moment there is still no plans to enact the changes which would have reduced some of this bureaucracy. So our previous committee did go to the government, and I know that that's been done previously, to express some of the difficulties that DOLS presents to us as local authorities. But as it stands at the moment, DOLS is likely to continue, hence why we're now going, we're going to have to recruit and train more. So just to try and make you think, what, because otherwise you might be thinking, Ruth, why have you not done this before? I would. So just to give that context.
Councillor Edwards, please.
Thank you, Chair. I just wanted to ask about in March 2014, obviously with the Supreme Court ruling and the huge increase of applications. Can you just give a bit more background on that, and with what you've just said? Are we going to be in 2 years' time in sort of the same situation, waiting around? Thank you.
Okay, so you're taking me back in time. So back in 2014, this was seen as landmark. So it concerned another local authority, not our own. As you can see, it was the Cheshire one. And basically what this did was you might have heard the phrase, actually, a gilded cage is still a cage. So before that, what had happened was, as an assessor, there were a number of people who I might assess who I'd go, actually, the one-to-one support they've got is of benefit to them, because actually they're going out, they're going into the community. Without that, they might actually be in a more restrictive environment. And this was all done in line with the law. That was how the law had sort of been written, how the guidance had been written. Then this ruling came in, and actually you can see the sense of it. If you can't consent to that level of restrictive practice, and if you think about being supervised on a one-to-one, it's quite intensive, isn't it? If somebody watched you all day, every day, you would start to think, what are you doing? And can you leave me alone? So you can understand that. And it was also to say that just because somebody isn't showing any objection, because this was the other part, because I'd go, they're not showing any objection, they're consenting to all of the care arrangements, they're engaging, they seem happy, I would then go, it's not a deprivation. And that was all in line with the law before that. This actually said, well, if I don't know what my restriction is, if I don't understand my restriction, the restriction is still a restriction, and therefore the deprivation stands. It's unlikely that we would have another ruling that would open it any more broad than what it already is, because it's about as broad as it can get. So if you're within in a home, like I say, which has a locked door, which you're not free to leave, and which people would stop you if you did, and you lack capacity, you're deprived of your liberty. So I can't imagine that it would do, but I never say never. Because we just don't know. What I hope is that actually we do have the review of the legislation that's in place, because actually, if you think about it as well, at the moment we assess everybody every year. It's actually quite restrictive in itself to go out there, assess somebody, go in there, ask them the same questions year in, year out. And that's why we're trying to look at what we can do in the right way, while still giving people the right level of safeguards around them.
Thank you. Councillor Wallins, please.
Thank you, Chair. Sorry for butting in. I did actually had a follow-up question. Well, I've got 2 follow-up questions, actually. Going back to my original question, has there been any external review been done to confirm the compliance in relation to shortening the assessment form? And I think it was Councillor Nixon that was on about the training. Would this training fully meet anticipated demands?
Okay, so with regards to outside, I suppose, do you not see ADAS as being outside of our local authority?
I mean,
I'm not trying to be divided. See, for me, they're an outside body to the decisions we make as a local authority. So from that respect, it gets the scrutiny from across the leads in that area. They are also advised by legal experts. So we have lawyers who work particularly through the Court of Protection who give advice and guidance to the ADAS group around these decisions that are being met. It has already been tested through the courts, because they're the assessments that we will submit, so the Form 3. Normally, if there's legal challenge, which is what I'd expect with this, if we had done something that wasn't appropriate, that actually then that legal challenge would come back from the Court of Protection, who have to register the deprivation of liberty. I feel quite confident that actually what we're doing is legal. I know you don't know me very well, so but my role as principal social worker is to ensure that we are legally compliant in all aspects of the work that we do. I take that role very seriously, and I'm here to challenge, you know, in that sense, the leaders within our organisation from the point of view of any decisions that we might make. And I stand here sort of in that sense as, you know, trying to ensure that. If it helps, I can get some of the information from ADAS as to how that process has gone through, if that might, you know, sort of assist you in assuring yourselves. It's a valid question. I think it's just understanding what else you might find beneficial to assure yourselves.
Councillor Wilson, please.
This is my last question, I promise. Just going back to the training, is there a significant cost attached to that, or is that negligible, it's all manageable within your limits, or do you have to put that through Cabinet, and how much is it, do you know?
Okay, so, and I think that would link in with your question as well, which I didn't answer about training, around whether it will meet demand. Unless I could train 100, it's not going to fully meet the demand. I think we're always going to have a need for some outside agency support, if I'm honest at this point, and because of the time. To answer your question with regards to the training, I have, part of my role is actually, is the workforce development budget. So I've worked this within an existing budget that we already have. So there'll be no need for any additional money than I already have for my workforce development. So this is what we're trying to work out at the moment, Councillor Wilson. So I'm going out at the moment. I reckon it's going to be between £800 and £1,000 per person we train overall, over the entirety of it. And that will include ensuring that they've got access to the appropriate handbooks, and that we're, you know, if we can work that all in, that's what we try to do, to make sure that they've got all of the tools that they need as well. It's a really important role that they'll have. So they need to have the best quality training to make sure that they do it as well as they can.
I actually have a question, if that's okay. Sorry. I believe you mentioned it a little bit earlier, but we understand that there was a proposal to change the legislation around dolls. Could you please give us some information about this and how it might affect what you're putting forward today?
Yes. So as I mentioned, there had been a whole consultation. This had gone on for some time, so we were expecting it to come in a couple of years ago. Sadly, it didn't. So the Liberty Protection Scheme, or LPS, as it was going to be known, was going to lessen some of the bureaucratic nature of this. It was going to look at us being able to authorise a deprivation. It was still going to be a deprivation, but for up to a period in the end of 3 years. So they would have an initial assessment, a further assessment in a year, then you could do it for 3 years, which would take into account for people who are in stable environments, who have a progressive condition such as dementia. But through that time, they would still have had access to review should there be any changes in their circumstances. It also then placed a responsibility on the NHS and not just on us as a local authority. So if the NHS were making the placement, they'd then be responsible for completing the assessments, not necessarily us as the local authority. So it would reduce potentially the burden on us. It would have also, though, have broadened it out to include people who are within supported living. At the moment, as I've said, this is only for care homes and for hospitals. If you are deprived of your liberty at the moment within a community-type setting, either within your own home, supported living, I'm sorry if I go on, supported living or say extra care or somewhere like that, that's then a community doles, and that is only heard through the courts. There's quite a lot of pressure at the moment on the courts. So the LPS was going to bring this all in. It was also going to use existing assessment processes. So our normal social work assessments, normal assessments done by health professionals could be used rather than them needing at the moment, as they are, to be done by additional people. So in essence, people at the moment might have, as I say, a number of assessments to basically do the same thing. So that was the purpose of LPS, and we saw some real benefits to this. It also meant then that we could use more of our workforce, because our qualified social workers could do that work, you know, usually within their practice, so it would have reduced the need. So there were some real benefits. I'm not saying it would have been perfect, and I'm quite sure there'd have still been forms that needed to be done in triplicate or something and submitted to the court, but it would have reduced the burden on us as a local authority. As I say, at the moment, we don't know. The mental health bill is currently the focus from a reform perspective, from an amendment point of view for the government, and I don't know anything further than that at the moment.
Thank you. Is there any more questions at all from anyone? No? Okay. So I think we're going to move forward with the... Sorry, Ben. No. So we need to consider at this moment how often we would like to receive a report about this and see how we would like to move forward with that. So I would like to question, when should we be able to see the changes that are going to take effect? Because I think that might help to see when we would like you to come back to talk about this.
As I said, I'm due to have a completed timeline done by October of this year. That should give you indication on projections, impacts, etc. That's where we're at the moment, and I would be able to update you post October.
So we said that we would talk about this during the work programme planning later, and then we will come back to this if that's okay with everyone. Okay. Thank you. No? Okay, so we'll move on to the next agenda item. And that is safeguarding online referral form. So I'd like to hand over to the Cabinet Member.
We will hand over to my learned colleague, and I'll jump in.
Okay, so I think this came directly from the last meeting. I think it was something that we mentioned when we gave an overview over the current work that we're doing. So this is sort of the end, I would say, of a long project that we had been doing that had closed with regards to ensuring that our safeguarding service is sort of fit for the future. And so you may not be aware, but our referral process into adult safeguarding has always been through telephone service. This was to do with ensuring that we had the right information at the earliest opportunity to be able to gather the right information to be able to make the right decisions at the earliest opportunity. We have a centralised, as you were made aware of at the previous meeting, we have a centralised safeguarding team that deal with all of those referrals. So to reduce the risk of needing to go back out for further information, we had it as a telephone call. But we actually have recognised that there's a lot of services that work outside of our normal working hours, that actually referrals, as with everything, have been increasing, and that really we should be making better use of technology that's now, that's now available. And it might seem like this has been late in coming, and I would be inclined to agree with people, but we have implemented now an online referral form. So this is primarily at the moment for our providers, so our care homes, etc., because they provide about 70% of all of our referrals come from our providers. They're also more likely to make multiple referrals. That isn't casting aspersions on our providers in any way, just that they're the people who are dealing with the majority of the adults who would fall into the need for care and support at risk of abuse and neglect. And this was done to support them in being able to refer in at the earliest opportunity, having listened to their feedback of, the length of time a call could take, that actually if they were on nights, they'd have to wait until the morning before they could make that referral. And this was to try and support them with that. So this has now gone live, and I can now tell you as of today, we are getting 10% of all of our referrals now made in this way. So I know it's slow in coming, but if we think it's only been on a full rollout since the end of June, the fact that providers are now starting to cotton on to this, and we're doing a lot of work with our providers, will mean that this will be successful. The next iteration of this will be to go out to all professionals. So that will include our health colleagues, police, etc., who again work overseas. We've just got to make overseas out of time. I don't know why I said overseas. They might work overseas, but I don't think that would be relevant to safeguarding. But out of our normal timescales, and what. And so we've just got to make a few adjustments to the form to make it more relevant to them, because they'll have different information and have different awareness at that time. So hopefully...
Sorry to interrupt just 1 second. I think the Cabinet Member just wants to jump in.
Interrupting you, sorry. Just in support of that, coming from the other side, which I did, where we were using the form, using the telephone, the effect this had was really considerable. It was so much easier and a lot more robust, because as you can imagine, if you can't put that data in that you need to get in straight away, you're going to get where it wavers with the information, whereas you can access it straight away by laptop. You can download all the information you've got with whatever practices you've put in place immediately to omit any further issues happening. So it is a system that has across the board made it a lot more efficient.
Yeah, so I think, I don't know that I've got anything more to say other than that it has been a long time in coming. We're really glad that it's finally in place. It has taken a lot of work. The other thing that I will just mention is that I'm sure you all read the CQC report. It identified within there an area of improvement for us was around ensuring that we give feedback to providers, that providers found that sometimes they weren't getting feedback as to the outcome of a referral that they'd made. This is hopefully this. We've now got a system with letters that can then go back out to the providers, and by them doing it online, that actually then helps us to sort of finish the circle, as it were, by being able to provide that feedback, which they're getting now not only if we've closed it at SAST, but if it's gone out to an area team for further inquiry. And that's it. I'll now invite any questions. Thank you.
Councillor Wallins.
As I said, thank you, Chair. I have done my homework in relation to all this. Ever since the online referrals have obviously gone live, what early feedback have care providers given since launch? Has there been any initial issues? And as a follow-up to that, are we addressing user concerns quickly?
Thank you for that. Yes, of course they've been giving feedback. So we did have some early issues with it. If people wrote in capital letters, as in all the way through, used caps lock, that was a bit of an issue. Who knew? Who knew? Also, the inappropriate use of commas seemed to cause a problem with the form as well in recognising things. We've dealt with those. They were all dealt with on the day that they were picked up. We have had some feedback from providers. Some providers have obviously said that they found it really welcome. As Councillor Rodderson has said, that they found it as a great way of being able to get the information sent in as soon as the incident happened, rather than having to wait, and also to be able to upload documents straight away into the online form. Some, however, have also commented that it's lengthy, that it takes them time to fill in. Now, this is really difficult because actually one of our problems before is people would use a sneaky backdoor into our service and email us once they got the VA Staffordshire email address. That led to them not giving us, that they'd write just a small amount of information and didn't give us enough to make a decision. The form ensures that they answer all of the questions, which I guess must be a bit frustrating at times from a time perspective, but they are done as skip logic. So if they've answered a question in a certain way, it's only going to bring up the relevant answer. So we have tried to ensure that they're not having to give us inappropriate information, but we are monitoring that. We have 9 providers who I would say we've got a very good relationship with. We've changed the wording of some of the questions when they've asked us to, because they haven't been able to answer it in its entirety, or haven't been sure what they're supposed to be putting in those boxes. So we've done all of that. The length of the form, though, and the information that they have to provide, I think is relevant to us. But we do continue to obviously engage and to work with them. We need them to use the form to help us, but also to help them. And as I say, we have got a very good relationship with them, so it does help us to continue those conversations.
To the Cabinet Member, please.
Just to confirm that from somebody that was very technic-phobic, and it found it very nerving to start going down that route. Even though the form is a bit longer, it is a lot easier and person-friendly to that person to use. And in the long run, using the form stops a lot of back and forth for information. Sometimes, a provider, depending on the provider, can turn information within 24 hours that safeguarding need to make a decision whether to continue. So even though the form is slightly longer, it is more effective and a more person-friendly or user-friendly.
Councillor Wallins.
Thank you, Chair. On relations to out of hours and so forth, how does the system handle urgent safeguarding concerns out of hours, and is there any backup for system outages or technical issues? Thank you.
So we do put on there that there isn't to be used for urgent safeguarding. So if somebody needs an immediate response, the online form is not going to give you that. So we still have the telephone option, and always out of hours, we would say to call EDS. So that information is very clearly on there. We have added another button on there, or question, on there, because we had in the early days received one referral that we felt should have been an urgent referral. Now, that means we make it very clear that it can take for the information, because this is all done with bots. I'm not very technical, so please don't ask me any technical questions as to how this works. I can just say it. So this uses bots, and the bots take the information from the online form and put it within our care director system, our system that we use. Now, that can take up to, that's what we say, 24 hours, which is why we say not to do that. And if it picks up any glitches, it doesn't transfer the information, then that's done manually. Hence why we've made it really clear with, in a couple of places now, as you go through the form, if this is urgent, don't use this form, please call. And if it's out of hours, please call EDS. If somebody needs urgent medical attention, call 999. If you need the police, call 999. So we don't see this as being the only way to make referrals. This, for us, is those non-urgent referral option for people, which is the majority, thankfully, of the work that we deal with.
Reverend Metcalfe, please.
Thank you, Chair. You've more or less answered the first question that I was going to ask, which is what happens if people don't have access to a computer or can't function with the computer, but the other options are still going to be available. The other question I have is to ask about cyber security. Quite a lot of sensitive personal information is obviously going to be available online and being accessed by members of the public who may have been compromised and so forth. What safety checks are there for data protection and so on?
Okay, so this is testing me a little bit, if I'm honest, because what I know is this system is secure. So it goes through it's all been through our information governance and our data protection leads within the council. So our online platform and our online forms that we have are done by our digital team within the council, and all of those safeguards and security measures are in place. The online form doesn't enable you to retrieve information. So once you've submitted it, you can't somebody else can't go in there and retrieve your information. It's not like a portal. You know, a portal where people might submit, you get an account, and then you can go in and out, you know, add things. It might be what we do in the future, but at the moment, this information goes in, but you can't get information out of it once you've submitted it. So in that sense, it doesn't allow people to gather that data. I understand, but as all these things are, as I say, that this system has gone through all of the relevant checks through our digital team, who I would refer to in that instance. But that gives me the security that it's secure as it needs to be. Sorry.
Cabinet member, please.
Just in support of that, and thank you for the question, because that was one of the concerns I had, is that the actual system is linked to wherever it's coming from. So in the care sector, it is linked to the manager's name or whoever, the responsible person that's gone through all the GDPR training, and that everything's in place for that. So potentially, there isn't going to be a leak because it's a direct thing from wherever it goes here.
Councillor Wallens, please.
Thank you, Chair. Has data quality improved compared to email referrals, and are we seeing a reduction in incomplete or inaccurate referrals? Thank you.
That's something that we're monitoring at this moment in time. As I say, it's only been in for a month. I don't think we've got sufficient data yet to be able to say as to whether data quality issues have improved. The early signs are good, but I wouldn't want to comment yet. What we've said is that once we've got 3 months worth of data, so we've only really started to see it go up to 10% this last sort of week and a bit. So previously, the numbers were too low for us to be able to comment on. I think give us 3 months and we'll be able to identify that. What we're trying to show is that actually, A, it's reduced the amount of research we've had to go back out for. So are we able to make more decisions right just on the information that we've got, and whether it's reduced the need for going back to the care home for further information, and also are we able to get better demographic data about the individuals concerned as well. So we're monitoring that, but at this moment in time, I would say, well, signs are good. I wouldn't want to assure you of that at this time.
Would it be possible to have the reports by the next meeting? I think pretty sure it's sometime in September, I would imagine.
We'll discuss this later when we do the work plan. We'll be going through times and when this will be coming back up again. Yes, to the Cabinet Member, please. Oh, Councillor Edwards, please.
Thank you, Chair. You might not be able to answer this one. It's not, no, I don't think it is. With the call-in and the online referral, do you know how much specific time is saved from the online referral to the phone call?
Again, that is what we're looking at the moment. So we're looking at this from an end-to-end perspective as well. You might not be aware, but the corporate call centre deal with our safeguarding referrals. We have specially trained call advisors there who pick those up. So what we're trying to do is track to see whether time waiting for calls goes down, whether they're able to pick more calls up, etc. So the call abandonment rate and those things that we monitor, whether that goes down as a result of this. Also then from that, what we're trying to work out from the feedback that we're getting from providers, how long did it take them? But then from our SAS team, so it's quite difficult, how long actually it's then taking them to make the decision? How often are they going back for research, and then how often does that decision take? So again, I would say hopefully in 3 months we'll have the start of some of that data. But I think you're absolutely right, because what I don't want this to have done to any part of the system is to have slowed down the overall response time, or or increased unnecessarily the time it's taking for the system as a whole. And when I say the system as a whole, I do include our provider colleagues in that. Thank you.
Thank you very much. That was really informative. Thank you so much. So I think we'll move on to the next agenda item, and then we'll look at how we're going to work with the work plan and come back for the next report on this. So, and that is the next. So we are working on the work plan now. I'd like to hand over to Helen. Thank you.
Okay, thank you, Chair. So the work programme follows on from the induction that we had in June, and also the informal work programme planning session also in June. And the work programme in your papers now has followed really your requests for items and scheduled those in throughout the year. There was 1 or 2 requests when we met for the informal work programme planning. There was 1 or 2 requests to move. We moved the February meeting out of half term. We also moved the youth justice item, but having spoken to officers, it fit well in the January meeting, so we didn't have to schedule an extra one in. You've been quite busy, hopefully, in the information that you've received, because there was a various numbers of items that you wanted more information on. So you've received the Casey report and review. That was emailed to you for information initially. You also asked for for information on elective home education. We've received the previous working group report that was done in 2018. You were asking for crime figures, including performance data, and I've sent you Commissioner performance reports, links to his meetings, which give you some of that information. And we've also put in 2 briefings, one this afternoon at 2, and those are online, and that's looking at the mental health in schools team and explaining some of their work, because one of the areas that you raised that you wanted further information on was how mental health could impact on attendance. So that's an initial starting point, is the briefing online with officers this afternoon at 2. That's all via Teams. And we've got a further briefing on the 9th of... you've already received a briefing on the 9th of July on the school-based overnight provision. And at that meeting, you agreed to give the officers further time for them to be able to get the data they need to be able to bring informed option choices, which will come back to you later on in the year. From this morning, there are 2 items that we've discussed that you will, or you've indicated that you want to bring back in some way, and it's about when's best to include those on your work programme. So you've got quite a busy work programme. You'll notice the only date you haven't got anything in for at the moment is in fact April. That won't last, that will fill. But that's your leeway that we're leaving at the moment for the extras. This, even though we've got this populated now, it is a dynamic document, so it changes to your wishes, really. There are some things that we need to be looking at in particular times, like the Safeguarding Board annual report, but you know, this is your work programme, so as things occur to you and you want to include things, it will change because we'll have to move things around to include the items that you're requesting. So you're looking at an update on dolls, and you're also looking at some more detail on the referral form. So it's when you want to factor those in. Now, there was a suggestion, wasn't there, that perhaps we look at November for the dolls. In November, at your November meeting, already quite a busy meeting, I have to say, because you've got the joint send and alternative provision strategy, you've got school attendance and inclusion, and you've also got the Adult Safeguarding Board annual report. So we could include that in there, but it would be quite busy. Your October one, I think, will probably be too soon to fit that in. You could look to move it, well, you could include it in April or move it to the February meeting, but February is also quite busy. Would it be sensible if I go back to Ruth and suggest that we have an update on both of those at the April meeting? That gives her more than enough time to be able to come back to you with informed explanation of how these things are progressing. Would April be a useful time for members?
Yes.
I'll include both items for today, from today in the April meeting, and I'll check in with Ruth on that. Is there anything extra that needs to be added, or anything that members want to raise for the work programme?
Councillor Arnold, I believe you sent an email. Would you like to discuss this and raise it, please? Thank you.
Yes, thanks, Lonnie. Right, I've had an email from the Chief Executive, Neil Harrison, of Dance Sport Association, and he's urgently seeking support because he feels there's a gap for children and vulnerable adults in extracurricular activities, such as dance, art, youth programmes, religious groups, and he's saying that there's currently a lack of formal safeguarding standards, which is obviously very concerning. And he says that at the moment he feels it's a postcode lottery as to how they're dealt with. So he's seeking some safeguarding support and seeking a review of the framework with a possible meeting.
Okay, so it might be worthwhile as an initial starting point for us to gather some information. So if members are happy, I can look at what regulations are in place currently and whether or not, and how those are implemented, or what checks and balances are there on their implementation. So if I do that initially, and then I can email that if I get it quickly enough, otherwise because actually it will need to be emailed because we haven't got a meeting now till September. So I'll try and get that information together and email it to you as a starting point so we understand what the rules and are and how they're enforced. And then from there you can decide whether or not there's further work that you want to do on that. Would that be helpful? And then I know the Chair, Tracy Doherty, isn't able to be here today, but she did mention the other day that she was interested in a further piece of work on elective home education. We have done 2 previous working groups on that, so it might be worth understanding what the figures are now before members decide whether or not they want to do another piece of work on that.
May I add to that, please? I think alternative education as well, because you get, because now especially for children with SEND, you have forest schools or schools where you go 2 or 3 days instead of 4 weeks. So not just homeschooling, but alternative education as a whole. Would that be possible?
Sorry, can I just ask as well, in certain circumstances we may need to go into schools. Do we have to have a check? Because I've been told recently that we don't. But I used to work for HR for schools and was regularly in schools, and we had to have a check.
So in what sort of check are you referring to? A DBS check? Okay. So I will go and check the rules as regard to county councillors. I know because 1 or 2 members have asked if they can visit previously when we were doing when we had the online briefing. I know Councillor Luca asked whether or not you could visit some of the special schools. I think there are difficulties in that because obviously there are safeguarding issues around anybody visiting a school. So I'll check and email everybody on the rules so that we all know where we are with regard to that.
Councillor Wallen.
Thank you, Chair. In relation to that, because I know I've been to the Ferrari School and Neverstowe School, I mean, all you got to do is sign in, and normally the head teacher will just accompany you everywhere, well, whatever he wants to discuss about and so forth, and yeah. So I can see why DBSs may be necessary in some cases, but I think when you're being accompanied by a head teacher or so forth, it doesn't really...
Just hand over to Helen, please. Thank you.
So I think some of it will depend on your reason for visiting the school. So if you're the local counsellor and you've been talking to your head and they've invited you in, I think that's quite a different thing, isn't it? So if I just get some clarification, because when members were talking about possibly visiting some schools as a group, that'll be potentially it's quite an intimidating thing, isn't it? A large number of people that you don't know visiting a school. So I'll check the rules so that everybody is clear on what you are able to do. But absolutely, if local head teachers are inviting you to come into their school, then there is, and they're with you, there is no reason for there to be an extra check. Can I just further add to the discussions on forest schools and alternative provision, and again with EHE, I think the key thing is for the Scrutiny Committee is to give some consideration about the way you want that information and why you want it. So if it's just to gain information to understand what these things are, that can be done just through some sort of briefing, can't it? Because it's really gathering information and understanding the different types of provision. But if there's a piece of work you want to do on it, then that's something that we need to bring to committee. So it's just deciding what it is. So would it be a good idea as well, along with the EHE figure, so you understand where we are before we decide to do an in-depth piece of work, whether that's necessary? Would it be also useful to get some information on the types of alternative provision that are in Staffordshire, just so that you're aware of what there is before we decide whether or not there's any further information or work that you need to do?
Yes, Reverend, if you'd like to.
It was me. It was fine, thank you. I know I did send an email to you, Helen. This is literally a month ago, actually, fully enough. And it was about illegal vape sales to young kids. I know it's disposable vapes have now since been banned, but there's always there's always going to be a black market following the ban and so forth. But as a kind of follow-up to this email, it's all right to propose this into a meeting about vape sales and vaping in underage kids and so forth.
There is in the work plan already age-restricted sales to children and young people ready for the 22nd of January. That is in the work plan.
Okay, thank you.
Okay, as there's nothing else, I'd just like to remind everyone that there is another meeting this afternoon. It is online and is through Teams. And then as well as that. Okay, so I would like to move to exclusion of the public, so that the public be excluded from the meeting for the following items of business, which involve the likely disclosure of exempt information as defined in the paragraphs of Schedule 12A, as amended, of the Local Government Act 1972, indicated below. Thank you.
And Chair, we have no items. But sorry, I would have stopped you halfway through, but you were on a roll. But no items in the exempt. Thank you.
Thank you, everyone. I'll see you all later. Thank you.